Hi friends, I'm Jasleen Kaur. I'm one of the registered nurses in UK. So I have cleared my OSCE exam recently in first attempt. Now I want to share my knowledge related to NMC OSCE with you, all of my UK friends and my colleagues and my Indian nurses as well. So this video is going to be an overview related to NMC OSCE and let's start the process. Okay, the overview. I'm just Kaur. I'm registered nurse. This slide also made by me. First of all, I would like to tell you about the assessment process of the OSCE. See, like in India, we do different kind of procedures. So uh, in like institutions, the teachers make like checklist to assess the students whether they are meeting the criteria, whether they are meeting the standards of the nursing or not. Same like that in UK, United Kingdom, the OSCE is like set of criteria whether the nurse is meeting the criteria or not. Okay, whatever procedure we do, there is unique criteria method to assess the skill. So candidate's performance is assessed against the criteria. Steps are there, and the candidate has to follow each and every step in order to pass. Therefore, there is like minimal. It reflect basically about the minimal standards the nurse is having. Okay, in order to register herself to the UK. For each station, like if the candidate is like fail to perform the step which is directly harming the patient, so the red flag is given to the candidate. Now we will talk about the stations in OSCE. There are total 10 stations. First is API. API basically constituting the four stations, okay? That consist of assessment, assessing the patient, assessment basically airway, breathing, circulation, disability and exposure. Okay, and planning means we have to make the two nursing diagnoses based upon the assessment of the patient. Then implementation basically is giving the medication to the patient, and evaluation is just referring the patient whether from one ward to another ward, whether to the community or whether to the specific team like dietitian, psychiatrist, etc. Okay, next is like our skill stations. They are basically four skill stations. Like in India we have same as in India we have IM injections, okay, subcutaneous injection, blood glucose monitoring, and pain assessment, wound dressing. Same like that we have different stations. Okay, moving to the next station is evidence-based practice. This is the simplest. Evidence-based practice and professional values are simplest. Talking about the evidence-based practice, we are giving with like a article. We are provided with an article. We have to read the article and take out the abstract about it. Okay, like basic, if the evidence is related to use of tap water versus saline for the wound healing, that we have to, like the patient is coming with the evidence that tap water is better over the normal saline, why you are not using that. So we have to read all the articles and list down the points. Okay, that is evidence based practice. That is only one station. Okay, and professional values are basically the ethics, what we feel in a certain situation, like we've got a nurse or any other healthcare practitioner eating the food of the patient, then what we do as a registered nurse. Okay, if we found that the nurse is not fit to do practice, okay, if she is doing the inappropriate methods of handling, then what we have to do, how we have to complain, what action we have to take. Okay, so that's all about the stations. and we have different time limits for each of and every stations that we will discuss when we explain in detail about the stations. Okay, so it is just a basic information, we don't have to panic or we don't have to confuse in it. Then fees for the OSCE, like in my case, the first fees is provided, like it is paid by the trust. Okay, if I got failed in the first attempt, then I have to pay for my reset. But they didn't deduct directly for all of like fees from at one shot from my the pay. They will cut from in installment. But thank God I have cleared my OSCE in first attempt. So for the like OSCE fees is 794 pounds, and for reset we have to pay 397 pounds. Okay, if we fail in three stations, if we fail in 7 stations or whatever, we have to pay the same. Okay, then how many attempts we have? We have total we have to have total 3 attempts in one application, like we have 3 attempts only. Okay, and if we fail in our first attempt, then the gap between the second attempt should be at least 10 days. Okay, then if we don't like pass in even on our third attempt, our application for NMC registration will get closed. Okay, then we have to start a new application if we still want to register with NMC. Okay, then we have to wait for at least 6 months before we start again the application. Again we have to reset for the OSCE and take the 10 stations. Okay, so don't worry, nobody like fail the third attempt. Okay, everybody got passed. So I will help you in passing the OSCE in first attempt. Okay, so please subscribe my channel, support me and like my videos. Thank you, bye.